one huge challenge is preventing relapse. So there are lots of development in that field, and we've been able to see several talks about the biology of CAR T cells, and that we have a better understanding of how they work, of their transcription profile, of their phenotype profile. There was a very interesting talk from Carl June during his lecture on the 2 patients who are probably cured from CLL with persisting CAR T cell, where we observed a shift from CD8 to CD4. That's very interesting and gives us cues for the future and for future studies. I see CAR T cells moving to the treatment of other hematological malignancies, as I said during my from the previous question, especially in CLL. It seems that we have been. There have been great progresses in CLL, and I'm sure we will see more and more patients cured in the future. Same in myeloma, lots of very interesting talks. And other changes will be the design of dual CAR T cells, and it was an idea a couple of years ago, and now we are seeing more and more studies on dual CAR T cells. Dr. Chen presented her results on CD19, CD20 dual CAR T cells. Very interesting. Another development will be the use of other cells, like NK cells, in the CAR treatment, and obviously allogeneic CAR T cells will be a huge help in the development of CAR T. Another interesting thing is probably the development of academic CAR T cells. And I think that our colleague from Spain are spearheading this field. And there was a very interesting talk on the Varnim-Captagen autoleucel from Spain, which was very interesting. And so that could lead to many European collaboration, like the CARAMBA project, and this is very interesting that Europe is able to mount trials with academic CAR T cells. And I would say that the last move is probably huge advances in the treatment of solid tumors with CAR T cells. There will probably be lots of development on that field. There is a huge unmet need, and oncology is definitely a target for research in CAR T cells. In the field of CAR T cells, I think there are 2 other very important discoveries or projects. There are development of CAR T cells against T malignancies, and we are following these trials closely. And that will be very helpful because T cells malignancies very hard to treat. Even with allogeneic stem cell transplantation, we have huge relapse rates, and we are starting to see trials with CAR T cells against T cells malignancies, which will be very helpful. And another thing I would like to highlight is the development of immunomodulation following CAR T cell therapy. And I think we've been hearing many studies, and very interesting ones from Catherine Thiebleman's group in Saint Louis with lenalidomide, and that I think is very interesting to follow.